Hi there, science fans. I'll bet some of you are confused by what seems like mixed messaging, especially the recommendations made by the CDC. What is probably not clear to the general public is that their recommendations result from the real-time acquisition of the data as it is generated in the general population. The CDC daily follows a group or cohort of individuals in various age groups, gender groups, and vaccinated and unvaccinated groups. As events occur in real time, various sentinels throughout the country collect public health data from these groups and then submit that data to the CDC. The CDC compiles, interprets, and evaluates that data and prepares reports that are then reviewed by a scientific panel to verify the accuracy of the recommendations coming from the reported data. After careful consideration, the CDC does at least two things: places some of the information on their website and makes recommendations to the public based on that data and the data accumulated up to that time. So the recommendations, which sometimes seem confusing, are a function of the real-time data being received at the time. One recent data point included the observation that some vaccinated individuals were being infected by the COVID-19 virus after being fully vaccinated. These are the so-called breakthrough infections. While this was a relatively rare event, it was undeniable. So it took physicians and researchers time to figure out what this meant for potential transmission of the virus to others. It was determined that some vaccinated individuals' symptoms were minor, not requiring hospitalization, and did not result in death. These data led to the recommendation of not wearing a mask if you were fully vaccinated. However, later it was determined that while fully vaccinated people were not being hospitalized or dying, they could pass the virus and infect others. Because of the Delta variant, the pandemic has morphed into the pandemic of the unvaccinated. This meant that fully vaccinated people could indeed infect those unvaccinated, including unvaccinated children under the age of 12. These real-time data are what drove the CDC to change their masking guidelines to now recommend the wearing of masks indoors. Recent data shows that more than 95% of those infected and hospitalized and dying are unvaccinated individuals. The CDC, having understood that unvaccinated people were most at risk, changed their guidelines to once again recommend masking and distancing indoors. A fully vaccinated person could infect an unvaccinated person who could then infect a vulnerable unvaccinated old person, a child, or an immunocompromised individual. Unvaccinated people are now preventing the country from reaching herd immunity. Some are suggesting that one should just wait and get COVID and develop immunity in the absence of the vaccine. Not a good idea, because even if one is asymptomatic, they can transmit to an unlucky unvaccinated child, or they could end up with what is known as long COVID illness. Vaccines surely trump that outcome. Perhaps what is even more problematic is that those lucky and unlucky unvaccinated people become incubators for further mutations of the Delta virus to an even more insidious virus that would not only place unvaccinated people at risk, but also those who are fully vaccinated. So become a part of the solution and become a team player and help your country achieve herd immunity, recognize the freedom of others, and follow the CDC guidelines. Mask up and be safe.